Om Amriteshwari Namaha. It is my honor and great pleasure to welcome you all to the inauguration of this symposium on sustainable and affordable healthcare innovations. Today marks a meaningful gathering of minds committed to transforming healthcare into a system that is not only effective and accessible, but also environmentally and economically sustainable. We are privileged to have with us a diverse group of experts, scientists, healthcare professionals, entrepreneurs, policymakers, and students who bring unique perspectives and ideas to the table. Your presence here reflects a shared vision to ensure that healthcare reaches every individual, irrespective of geography or income, without compromising the well-being of our planet. As we navigate the challenges of rising costs, resource limitations, and increasing health disparities, the need for innovative solutions has never been more urgent. From frugal medical devices and digital health medical devices, digital health platforms, to eco-friendly hospital infrastructure and community-based care models. Innovation is the key to bridging the gap between affordability and quality. Artificial intelligence plays a transformative role in achieving sustainable and affordable healthcare. By enabling early disease detection, predictive diagnostics, and personalized treatment plans, AI improves outcomes while reducing the cost. AI-powered tools streamline hospital operations, optimize resource use, and support telemedicine, expanding access to underserved areas. In drug discovery and medical imaging, AI accelerates innovation and enhances accuracy. Importantly, AI systems can be deployed on low-cost devices, making advanced care accessible even in resource-limited settings, similar to that of rural areas or villages. By driving efficiency, scalability, and equity, AI is a key enabler of smarter, greener, and more inclusive healthcare systems for the future. Now at Hut Labs, we have developed or have been developing since 2010 healthcare devices. Well, we do many things in Hut Labs, but one of the focus is healthcare devices. The first one that we built in 2010 was a hand gesture based control wheelchair. Right? You move your hand and control the wheelchair. The motivation was the quadriplegic patients. Quadriplegic, those who have lost the ability to move from the neck till the feet. Right? They can move their head or eyes, but otherwise they are bedridden. Right? But then, how hand gesture going to use it? But during therapy, they can regain some motor functions in hands. Even if they can move their finger, they will be able to control the wheelchair. So that was the first wheelchair designed and successfully demonstrated at Amrita Institute of Medical Sciences by none other than final year students, BTech students. Right? So the wheelchair won the gold medal in the India Embedded Challenge by Intel Incorporation and also won the best prize for the humanitarian technology. So the second one, with that we started developing many devices for the hand gesture, then voice control, then eye-based, then head control, then BCI, right, brain computer interface, finally fully autonomous, right? So a wheelchair like similar to autonomous cars, right, driverless cars, right? You sit in the wheelchair, you either spell out the destination or you touch in a screen where you want to go, the wheelchair takes you there. So Remember, all these different modes of control methods have been tested and proved again and again at our Amrita Institute of Medical Sciences, particularly the Department of Physical Medicine and Rehabilitation. Now coming to the pandemic time, right? So I remember, right, everything closed, everything shut down, right? College and all closed, nobody there, nobody knows what to do, right? And ashramites restricted to ashram. Well, I am also ashramite, but few people have to be there in the university, right? So I was one among them, right? Now, people at the ashram who were researchers and many other faculty involved in research, Amma has given a specific task to them, how they can build some devices quickly that would help with the patients suffering due to pandemic. Right. So I was not there in the meeting because I was on this side. The Chancellor met the top people and conveyed that we should do something, right, as researchers. Then somebody brought my name, right? Rajesh Kannan is not here. He has done few things, right? Then Amma immediately told, he has so many things there, but he is doing nothing, right? So this was a trigger for me, right? So within 2 months, you won't believe, within 2 months, right, we were able to build 5 different devices. 5 different devices for the cause of the pandemic, right? One is the ultraviolet radiation, right? So it is like you desanitizer robo, a hooded wheelchair for safe transport of COVID patients, a teleoperated wheelchair, right, where the pusher need not touch the patient or the wheelchair, right? And Annapurna, the food and medicine delivery robo. It can go into the room. You don't need a person to personally go into the isolated wards, right? So within 2 months, we were able to showcase or build these devices, and they were used, some of them in AIMS and some of them at Amrita Kripa Hospital at our Amritapuri Ashram, right? So then after that, we did not stop. We were like continuing till date, right? The latest one in the list is the device called Netravar, eye-based communication system, right, for the people with speech issues, particularly due to accident or the stroke, who become bedridden and they're not able to convey, right? So we have developed this device where the device integrates AI algorithms to capture the eye movements and convert it into words and sentences. Well, there are not this particular device in India, but similar device. 1 or 2 is available in the world, but they are limited to only indicating the need for the user, whereas the device we build can give the user full freedom, full communication back, in the sense that, for example, let us say that a professor become bedridden due to stroke or some accident, right? Now after the recovery, right, if the severe stroke, right, if it's still bedridden and not able to speak, the professor can continue teaching classes using his eyes, right? So the full communication, like as I am speaking now, through using my like tongue and mouth, the professor can use the eyes to continuously talk and deliver a lecture. So such a system is the first of its kind in the world. We have already applied for the patent of that device, and the inspiration came from none other than our Chancellor, Amma, right? So this was because there used to be a patient, right, when Amma goes to US tour, America tour, this patient will be like, he used to come visit every time at San Ramon, California, right? So he would be on the wheelchair or a stretcher. He is fully bedridden, he is quadriplegic, right? So Amma gives him special attention, like caresses the entire body, apply ashes and everything. He used to communicate to Amma through an interpreter using eyes, right? He used his eyes and the interpreter would be able to tell what he want to convey. Now Amma asked me whether you can build a device which will not require the interpreter, right? So we have built a device which will not require an interpreter, which will capture the eye sign and convert that into speech, right? So that is successfully built, and also we have launched a startup with the support from the TIMED, which is the startup part of the Sri Chitra Tirunal Institute of Medical Sciences, right? And now we are trying to make sure that it reaches the intended people, right? So looking all these things, it is right time that we collaborate with many organizations to make sure that these devices are not only exhibits but reach people who are in really need. We can't do it alone. Researchers cannot do it alone unless all the stakeholders come together, like Saksham or Adarsh Charitable Trust. Right, we are also in touch with NIPMER, National Institute of Physical Medicine and Rehabilitation, right, that is from Thrissur, the NISH, National Institute of Speech and Hearing, Trivandrum, right? So we want to bring in all the stakeholders so that all that we build, develop, right, reach people and attain their goal, attain their purpose. Now with this introduction for the symposium, I would like to take this opportunity to first welcome our chief guest today, Shri P.R. Madhavan, Founder Secretary of Adarsh Charitable Trust and Founder Proprietor of Rehabilitation. Welcome, sir. Next, I would like to welcome our guest of honor today, Dr. Balachandran P., President, Saksham Samdrishti Shamata Vikas, Evam Anusandan Mandal. Welcome, sir. Next, I would like to welcome our Dr. Gayatri Narayan, Vice Chairperson, Department of Electronics and Communication. Right, Department of Uplifts is very much associated with the Department of Electronics and Communication Engineering. So, welcome, Madam. I would also like to welcome the today invited speakers. Shri Shantanu Gaur, Healthcare AI Adoption Specialist, MAITI, NASCOM Center of Excellence. Welcome, Shantanu Gaur. Then next, we would like to welcome Dr. Atul Joseph Manuel, President-elect, IMA Cochin Managing Trustee, Arike Care, CM, Open Healthcare Network. Welcome, sir. We would also like to welcome our speaker, Dr. Parvati Unnikrishnan, Associate Professor, Department of Prasuti Tantra and Stri Roga, School of Ayurveda, Amrita campus. I would also like to welcome all the members of the Saksham, all the members of the Adarsh Charitable Trust, the faculty, the researchers, and the student community for this symposium. So we have very good talks today. We hope that all of you benefit from the experience of these expert speakers. So with that, I would like to thank everyone for giving me this opportunity to welcome our distinguished guests and everyone else. Thank you very much. Om Namah Shivaya.